Welcome everybody in our Zoom Direct and everybody on YouTube, Facebook, LinkedIn, wherever the live stream is going. This is um, a great start. This is the day when the first Knowledge Festival is going to take place. And just as a short introduction to the whole idea of the Knowledge Festival and the Open Attempt organization, which is responsible for organizing this whole event. So Dr. Vinayak Nair Radhakrishna, who will talk to you later for a few minutes to explain some concepts and ideas behind the organization, had this idea basically that something has to be done, and that we have certain issues all around the world, as we all know. Some things might not be working all that good. So we have to do something about it. Everybody has to do what they can. And so we came together and tried to find the best ways out of this kind of misery, ways to do something about it. And we found out, or it's pretty obvious, that all the solutions might be there already. We have so much knowledge all around the world. There is so many people with great ideas. Also, going back in history or in different cultures, it's just almost everything there. So if we can get people to come together from different systems, from different areas, from different cultures, and just sit down and talk to each other to find solutions to the same issue that is here just as well, just as there. And we can find things that work. And this is a very important part of our work, to find practical solutions, to find things that everybody every day can work on, can do for themselves. So this way we just started out, and the Knowledge Festival was the idea to bring those people together. And it started out about 2 years ago. We had the idea to bring everybody together somewhere in Europe, and to have those experts talk to each other, with each other, and find some solutions that we can apply in places, we can offer to governments, and so on. So that didn't work. As we all know, COVID came, and things just changed. So we found out maybe we can do even better with, the online community. Maybe we can use all these online tools to make an even bigger community to come together, even more people, more experts from more systems and concepts come together. So this is what's happening now. And it's not that we have only health issues, because the Open Attempt organization came together to find very selective kind of ideas and solutions to certain issues. And those can be in 4 different departments, which we thought are probably the most um, obvious um, points to attack, to hack at, maybe. That's health, of course, that's the environment, of course, also agriculture, because the food is, as we will find out, as we found out with the pre-talks, is one of the most important parts of our system, be it our immunity, our financial system, or whatever. And then the human rights issues, human values, um, which all go together. And now the first Knowledge Festival is about health issues, is about enhancing methods of enhancing the immune system, because we're in the middle of the pandemic, and maybe having strong immune systems can be very helpful. So we did this, but next time it really might be something totally different, and we will announce it once this one is about to get over. So, but it will be something different than the health issues. It's probably some environmental issue that we will be tackling with the experts around. So now today we are starting out. We will, this is how it works. You can find all the information on the website, the knowledgefestival.org. But you just see how it works today. From tomorrow on, we will be starting a few hours earlier to just get all the information in. Now, we will have some experts presenting their papers, their ideas, their concepts, and we might have one or two questions and a short talk about it, but that's for one part, and then we'll have a short break, and after that we'll have some experts from our advisory board who will discuss this issue of development of the immune system is today our topic. So we'll have a few rounds of questioning and answering, and all of you viewers from all the social media, YouTube, you can just send in your questions whenever you something comes to your mind, and as far as possible, we will use those questions in our discussion here. So now this is the basic idea. Now we have people from many different medical systems around the world, from the modern medicine to the most ancient ones like Ayurveda and Siddha medicine and Unani and Persian medicine and Tibetan and all kind of medicines, of course traditional Chinese medicine. And so once all these people come together, we can find out what each of these systems will think about a certain topic, and then in the end we will have something that we can do about it. And this is very important to us, to have some extraction that is very practical and is doable for everybody in their daily life, and that we can bring in with some governmental agencies to implement it on a daily basis. in certain maybe parts of society or for certain issues. So with having that said, we'll go on to Dr. Vinayak Nair, who is the founder of Open Attempt. He will um, come in with a few words to start the Knowledge Festival. And in a few minutes, we will go on with the first paper. So now I pass on to you.
Thank you, Wes. Namaste to all of you. I think as Wes explained, actually, we've been working on this for almost like 2 years. The organization itself, I think from 2015, we are kind of evolving actually from the very idea of what we can do. And in between, actually, when we started, we had around 9 departments to put forward. But we realized that a lot of things, it is still within not people's view to understand that. So we thought we will put it to just 4 departments which everybody can look through, because, for example, environment, if you look out of your window, if you know the things has to improve, something that you can look within you, and agriculture of food, I mean, yeah, this is also something that is very important, and what is going inside, so I think agriculture also is very important initially. And I think before we wanted to do this on immunity, in fact, we wanted to do the whole festival on how to grow your own food, because we are also working with the basic idea of locally sustainable concept. So that's why also in Austria, we are, especially for our organization, we grow our own vegetables, and we are trying to make a smaller village here sustainable in terms of food production. So initially the idea was to start with something like that, to encourage people to kind of grow their food in the community, and and improve the overall quality of what we are eating in the society, but of course, as you know, COVID came in, and of course, then we thought, okay, I think we have to address the issue. So even though we are speaking here about immune system, but I think, as you would probably know, the whole topic is divided into 11 subtopics. So we are looking into how, right from development of immune system, what are the components of immune system, what do you understand by immune response, what are the, for example, what is the role of mental health on immunity, what is the role of environment on immunity, what is the role of nutrition on immunity, role of sleep, exercise on immunity. So all these factors, I mean, if you see, they're not medicine oriented actually, so they need to look into more as a society how we function, and then, of course, in the end, we have aspects of medicine that work on immunity, and therapies that work on immunity. And also we'll end with speaking about the challenges we have in the field. So first of all, I would like to actually thank all my team, because as I said, from my idea to really make it into something, you need the right kind of people. And I thank everybody in the team for really working for the last 1 year. And all of us are volunteers, because we all have a normal job, and we do that in a free time. So we also welcome all of you who are here and who are listening to us. We are looking for people to work with us. So if you're interested to work with us in terms of any of those projects we are working in Open Attempt here, please write to us. We'll be happy to have you on team. Today, especially with this Knowledge Festival, as I said, the idea is to have this idea of integration and bringing the different health systems together, because I've been an Ayurveda practitioner for the last 23 years, and especially being practicing here, I have seen that it's actually very easy to work with other school, like modern medicine doctors and other people. So there is a way that we can come together, and as we've also done a lot of pre-talks, and we realize that a lot of things that we speak, because the process that we speak about as life is same. We are just expressing that in different languages. Maybe in Ayurveda we say it in a different way, in modern we say it in a different way, but the process itself is same. So the whole goal of doing this is to come to a point where we understand what is similar in each systems, what is special about something, and how actually which are the areas where we need to do more research and things like that. So I would like to first also thank all the advisory committee, because I think for the last 1 year they are with us, and they also did a lot of pre-talks before this, and explained basic ideas about each system like Siddha, Ayurveda, homeopathy, and naturopathy, and things like that. And I would really like to thank them from the bottom of my heart for staying with us for so long. And in fact, the main work begins today actually of really coming together and discussing about the whole thing that we've been working on. I also like to thank all the participants who have submitted their papers, and I want to congratulate who are today actually presenting all the papers here in the festival. Um, Unfortunately, we could not take all of them because of the limitation of time and everything. But I want to tell you that even though if your names are not there on the list, we will actually consider that when we are writing the whole thing actually, and you will also get access to the festival. So be with us even though if you're not presenting the paper here. For discussion today, actually, as I said, the topic is development of immune system. So we try to focus that on that particular thing today. So any questions that you have regarding that, for example, if what is the role of mother's nutrition in developing of immunity, or is immune system, continues to develop as we grow, and things like that. Any question there, because actually for the last few months we have posted around 50 questions on our social media, and we also asked public to kind of put their questions through. So we request you, anybody who has any questions, this is the right time to put it through, because we can bring that together in that platform. And I have to say that the work of the whole thing is not finished with this festival, because this is, we can say we are midway in preparing this report. So once we do that, actually we have actually asked the advisory board after the discussion to submit a summary of what they have learned in this process. And what we are doing is we have kind of developed a new method to validate a statement, because I can give you an example to make you understand that. Let's say, for example, if we make an example that, let's say, turmeric or curcuma longa is antibacterial or antiviral. If you make a statement like that, what we are trying to do is we are validating it under 7 subheadings. So the first one is if there is a historical or ancient reference to the whole thing. So was it something new, or was it mentioned long ago? As far as turmeric concerned, it's mentioned in the Vedas and really ancient texts and things like that. Second thing is whether this knowledge was culturally or traditionally practiced in day-to-day life, because there are so many things that you find in ancient texts and things like that, but maybe that was not very practical in day-to-day life. So whether turmeric, for example, was culturally relevant in this issue, yes, I think it was. So we can also say, okay, it works there too. Third thing is practitioner's validation. As a practitioner, do you think I can use turmeric to have that effect? The answer is yes, because you can ask any practitioner who's using turmeric, and they can tell you the benefit of using that in various conditions, not just for that. So there's a practitioner's validation. The fourth point is whether any research has been done to really understand if what is there in that plant, that causes that activity. So like, for example, if there is curcumin in curcuma is antibacterial. So now we know all that. So there are enough research done, so research-based validation. And out of all that research, how many have been peer reviewed? So how many have been really looked into, and in proper journals and things like that. So validation based on that, and validation based on whether this knowledge is personally applicable to someone like me or anybody, for example, a public. So I think with turmeric that is also true, because a lot of non-medical person would actually tell you the benefit of turmeric. And the last point is whether it is limited to a geographical area, like let's say India. Is this knowledge only limited to India, or has it spread around the world? So with turmeric, you see that it has actually spread around the world in a way. So any statement that we make, whether we say exercise improves immunity, or no, you need to have vitamin D to improve immunity, and things like that, we will validate that in these 7 steps. So there is a process involved in the whole thing. So that's why I say it's a midway for us to actually prepare the report, and the whole thing is open to suggestions as well as corrections. So once we do the discussion today, actually we will prepare this summary and it will be on our website. So anybody can come and edit. For example, maybe today we don't have anybody from Chinese medicine. So let's say somebody else can come later on and add the points from their system. So this study will be kept open till we finish or satisfied with what we are looking for actually. Today, I mean, we have doctors from Dr. Thirunarayan sir. Actually, he has been with us for a pretty long time, and I'm happy that he's actually starting the discussion today. From Siddha side, we also have Dr. Krishna Sharma sir. He's actually Dean of Mangalore University, representing the yoga side today actually, and he has been also with us for a pretty long time. We also have Dr. Shabuddin sir. He actually the registrar of Kapu board is representing Unani medicine. I'm not sure if he will make it because there was some emergency in his family, so we are still waiting confirmation from him. But if he cannot make it today, he will join us on another platform, another subject. It's no problem. And then we have Dr. Geeta Sharma, who is actually a practitioner naturopathist, and since 16 years she has been in the field, so she's representing naturopathy. And I think also we have I think one more. I think let's maybe have a look here. Yeah, and Dr. Satya, of course. Yeah. So Dr. Satya Dornal, who is actually from Delhi. Actually he's from Hyderabad, but he's a practitioner doctor from Delhi who is also representing from the Ayurveda side. So we expect that we have a good discussion down the line. And as I said, if you have any questions, please feel free to ask the panel members. And I would ask actually now Wes to take over without much time. I think we are already on schedule. And if you have any questions, please feel to write to us. And I think all of you have also have our numbers. So I go ahead and give it to Wes to carry further. Thank you.
Okay, good. So now we have, the first paper to present, and just wait a second. We have some of our people coming in. So that was great. Now we have our first paper. This is from Ms. Varsha Roji, Dr. Varsha Roji, who is actually in her final year of Siddha medicine. And this is very important to us also to have, because we really have so many accomplished experts here on board, which is great, but we just believe in talents being at any level and any step of the way. So we definitely wanted people to come in with their ideas if they are highly known experts, or if there are like our first papers that we present today, final year students or people with even some practical knowledge of certain issues. So this is very important for us to have this kind of democratic setting. It's not that you are made by your titles, it's just you're made by your ideas, and once you present them, we can discuss it, and we can find out what is good about them. So here we have Ms. Varsha Roji, who is going through her final year of Siddha medicine, and she will be talking about, of course, the immune system, but the development of the immune system in children, and all that from the Siddha aspect of it. Because as you found out, we have Ayurveda, we have Siddha, we have modern medicine, we have Chinese medicine, and they all have different ideas about it. Now, without further ado, I invite Ms. Varsha Roji to take over. Also, I will have to take care of the presentation. So just give me a second and we can go on with the presentation. All right. Share the screen. So it's yours. Just whenever you need me to move on with the slide, just say next. Please, go on.
The screen is not visible. I could not see anything.
Yes, I saw that right now. This is a live setup, so we'll have still not. Oh, we'll find.
Can I share my page?
You can share too. Yes, if you can.
No problem. I will share.
You can share it too. I'm just. Oh, it's not there yet, right? So now, right?
The screen is overlapping.
It's not working with you, or is it?
Yeah.
Try. So,
Can you try putting it in the full screen?
Vinayak, do you see the shared screen right now?
Yeah, I see the shared screen.
Yeah.
You just have to put it in full mode, you know.
Let me see. Where is that?
Slideshow. Slideshow.
Yeah.
Start from first slide.
All right.
Okay.
Click the next.
Now you see.
It's visible, but it's empty actually. The first screen. Can you go to the next slide?
I'm doing so.
Hi. Now it's working. Yeah. Okay. Yeah. Okay. You have to click few
Shall
times.
Yeah. Shall I start? Start.
Yes.
Okay. I need my first slide, first page. First slide.
I'm going there.
Okay, it's just a topic.
Unless you have to go back.
Yeah. So we're at 1 from 21.
Shall I start?
Yes.
Okay. Hi, good evening to the all guests and my dear presenters connected. Myself,
Sorry,
Varsha Roji.
maybe you can turn on your camera because you're turned off.
Okay.
Very good. Thank you.
Good evening to all the guests and dear presenters connected. Myself, Varsha Roji, doing my final year PhD in ATSV Siddha Medical College. I'm from Tamil Nadu. This presentation is mainly about sharing my uh, uh, clinical experience and some medicines of Siddha, which boost up immunity and modulates immune system among the age group of from infants to children age group. So this mainly concentrates only on the clinical experience. Okay, next slide. Next slide. I start my presentation with Tirukural, Tiruvalluvar's Tirukural. First one is Miginum Kureinum Noi Seidi Noodor Valimudala Inniya Moondru. So what this phrase says is, according to the Siddha concept, there are three humors, Vada, Pitta, and Kava. Any imbalance, any equilibrium changes over the three humors of the body will lead to the disease. So that is indicated in that phrase. And coming on to the next phrase, மருந்தன வேண்டாமா யாக்கைக்கு அருந்தியது அற்றது போட்டி முனி. What this phrase tells is, we have to take our food after the digestion of the meat that we have ate previously. So before digestion of the previous meal, taking up of next meal will cause a disease. So where it starts with, here it starts with food, lifestyle, and diet what we have taken. So any changes over the food, diet, or lifestyle will leads to ease. Next slide. Thus immunity and health starts from the food we take. So coming with the next slide, I'm from the side of Siddha. So I here enhance what is Siddha and from where it originated. So I will be giving just a brief line about Siddha. So Siddha system is attributed from the ancient sign called Siddhas. So Siddhas, there are 18 Siddhas, and Siddha system of medicine is originated from Tamil Nadu and mainly has its origin in Tamil language. All over the globally, we have many traditional system of medicine. India, we have diverse system of medicine, maybe followed by Siddha, Ayurveda, Unani, Yoga, Naturopathy, Homeopathy, and so on. So among that, Siddha have a unique system of medicine, a unique system of medicine, and has its special features also. So Siddha medicines which have been prescribed to the patients for the ages and ages, and it gives therapeutic effectiveness and with insignificant side effects. Okay, next slide. So according to Siddha, I go with the line: food itself a medicine, medicine itself a food. That is meaning of Tamil phrases. மருந்தே உணவு, உணவே மருந்து, மருந்தே உணவு. That is the meaning of the line. So this is the basic concept of the Siddha medicine. So health, immunity, all starts with the food. Food that we take will determine our health and immunity and everything. So food is to be considered as a basic building material of human body, which will be later transformed into the humors, body tissues, and waste products. So as I earlier said, the equilibrium of three humors, that is Vada, Pitta, Kapha, according to the concept, is considered to be health. That is the equilibrium of these three humors will maintain the health, and any equilibrium changes over these three humors of the body will lead to the disease. So food, diet, lifestyle will play an important role. Maintaining three in an equal line will always lead a person or a individual to be a healthy and will keep it free from the disease. So among population, children will be the most unique and an important population, right? Child from the infant stage to the children's stage, the path they have been crossing, they have both physical and mental growth. So we have to take a much more care on children, and we have to boost up their immunity in their stages, to keep them from the disease. So, what's immunity? Immunity is the state of being able to resist a part of disease or preventing the development of pathogenic microorganisms. So, children who are in the growing stages, they need immunity compared to the population of adults. So, we need a much more care in children's population. So, next slide with the types of immunity. I hear just briefly saying about what is immunity, what are the types we have in immunity. So immunity types is follow have two types of immunity: acquired and innate immunity. Innate immunity we will be having it by the birth on our own. So acquired immunity is the immunity we will be gaining it throughout our lifetime. So that acquired immunity will be further divided into active and passive, and that active and passive immunity will be furthermore divided into non natural and the artificial. So natural active immunity will be acquired from will be acquired by to the response of any infection. Then artificial activity will be developed in response to the antibody that will be if we take a vaccination, the antibodies developed in a response to a vaccination. That type of immunity will be called as artificial activity. And then passive natural immunity, that we will be getting it from our mother's breast milk. Then passive or artificial passive immunity that we will be getting by taking any immunoglobulin injection or the infusion of any immunoglobulin injection or other than like that. Coming next slide. Okay. Immune system, among the immune system, immune cells plays an important role. What are the immune cells we have? Macrophages, T lymphocytes, mast cells, basophils, T lymphocytes, natural killer cells, and dendritic cells and neutrophils, and everything. And the functions of immune cells and their functions will be given on the next picture. Next picture. And these are will be the functions of the immune cells. Next slide. So coming on to the next slide, immunity in the Siddha aspect. So this is the most important slide of this presentation. So I go with the Tamil phrase that Vadamai Padaitu Pitta Vanniyai Kaathu Setna Seedamai Tudaitu. This is a phrase according to the Siddha concept. So meaning of immunity is taken care with the increase of alal. So as I earlier said, three humus, Vada, Pitta, and Kaba. Any changes over these three humus will lead to the disease. So imbalance of these humus lead to disease. So drugs which we give for the children to children is will correct and uh, maintain the humus which have been decreased or increased. Okay, next. Here I mainly concentrate on two medicine, Urai Matiri and the Seine, which is the Siddha formulatory medicine we have been using. So, explaining first with Urai Matiri. Urai Matiri is a polyherbal formulation, Siddha formulation, and which is using for traditionally for past 5 decades as an immunomodulator, immunobooster. And Urai Matiri, and what form of Urai Matiri is? It will be in the form of long finger-sized bullets, which can be administered to the children by rubbing it with the breast milk or with the honey. So this will improve the immune system of the children. Not only Urai Matre is used in a immune booster, but also it is used used in the frequent recurrent infections like respiratory infection, GIT infection, anorexia, and so on. Various studies have been taken place in Urai Matre, such as subacute and acute toxicity studies, then quality standard, then more studies have been taken in Urai Matre. So So here I mainly concentrate on administration of Urai Matire to infant and child age group. This is also uh, have a good result over the pediatrics and geriatric age group, but I mainly concentrate on infant and children's age group. Next slide. Urai Matire, uh, as I earlier said, polyherbal Siddha formulation, which is a good immunobooster and an immunomodulator, which also prevents a contagious disease and also disease like mandam, which is indigestion, kanai, primary complex, and chronic cough and fever. So, Ure Matre is provided in all OPDs and PHCs of government Siddha hospitals in Tamil Nadu, which are used to give up for boost up immunity of the children and children and infantile age group. So it has both good positive uh, clinical studies or clinical studies. So it has greater ability to cure. Hmm. Next slide. So coming up with the ingredients and the procedure and dosage of Urai Matre. Urai Matre consists of 9 ingredients, namely Sukku, Adimaduram, Akaragaram, Vasandu, Kadukai, Sadikai, Masikai, Poondu, Tipili, and Perungayam. 10 drugs will be given here. The Urai Matre consists of 10 drugs. And next slide. Procedure of Urai Matre is powder of these drug is made into a finger-like capsule, and adjuvant of this medicine is they are administered by rubbing it in a breast milk or on honey. It can be given from an infant to childhood age group, and clinical dose of Urai Matre will be 50 mg, maybe 10 mg or 20 mg, depending on the children's age and their weight. So reference, it is referred from Pharmacopoeia of Hospital of Indian Medicine. Next slide. So how Urai Matre acts on body is, Urai Matre, as I earlier said, it is made up of 10 ingredients, out of which majority of ingredients possess heart potency and a pungent taste. So these threads in the post-digestive transformation get converted into fire mochi, which can increase the allele of the body. As I earlier said, the 3 humors, Vada, Pitta, and Kapha. Any equilibrium changes over these humors of the body will lead to a disease. So intake of these drugs will balance the humors and will provide immunity, boost up immunity and modulate immunity among the childhood age group. So that is the Tamil phrase I earlier said, Vadamai Padethu, Pitta Vanniyai Kaathu, Setna Seedamai Tudai. So immunity is taken care with the increase of allele. Next. These are the pictures of Urai Matre. The upper picture, which is a uh, uh, finger-like capsules of Urai Matre. And the Urai Matre is also found in the tablet form, which is from the pharmacy here. And we can found we can buy Urai Matre from many pharmacies. Okay, next slide. So coming up to the next medicine is with Say. Say is the term we used in Tamil for infants. Infants, Say is infant. Say means infant. Sayனா வந்து குழந்தைய வந்து infant சொல்லுவோம். So Say, which we Tamilians have an tradition or a ritual, maybe saying as ritual after the birth of each child. That is Sene Totu vehicle. The ritual will be performed. So in olden days, they will be preparing the Sene and will be going with that ritual, Sene Totu vehicle. Nowadays, they are performing this ritual, but they will be now they are not preparing this Sene. Instead of that, they were preparing sugar syrup and doing that ritual, and it is not good for health, and it is something unhealthy for the child. So my aim is to um, bring back this saying to the practice. Okay, Seinai mainly the main key feature of the Seinai will be citramanakennai. The main ingredient will be citramanakennai. This that is castor oil. This castor oil is not taken by the method of cold press. This dried, it is taken by boiling the dried seeds of resinous cuminous in a tender coconut water, and the oil floating over the water will be collected and be used for the preparation. The above mentioned procedure, that is boiling of the resinous seeds in a tender coconut water, that procedure have to be done for 6 times. So that procedure is done for eliminating the any poisonous effect over the resinous seeds that would not affect the children. So that oil is prepared and taken, and following 46 ingredients, which may many of the ingredients will be in the form of charu, or some ingredients, 13 ingredients will be in the form of katkam, and that with that juice and the parkam and with that resin castor oil, we will be preparing seining. So these are about the seining preparation. And coming to the dose of seining, next slide, next slide, next slide. These are these will be the ingredients which are involved in which will be added on the seining. Okay, coming to the dosage of Saini, up to 1 year of age, 1 drop per OD will be given. Up to 2 years of age, 2 drops of OD, and 3 to 5 years, 2 to 5 drops OD will be given for the children. Then Saini, how Saini plays an important part in is the Saini will be provided to the infants after the birth, even before feeding of the breast milk. So this Sene will be given for children from the day one. So it will provide more immunity. Thus, it will modulate immunity and give strength and the health to the children from its day one. So it not only provides immunity, but it also prevents kanai, that is I earlier said this primary complex, mandam, that is indigestion, then kakuan, tattamai, which are all the smallpox, chickenpox, and the viral infection. By giving the same we can guard children from those viral infections and those infectious diseases and so on. So it plays a vital role in the area of immunity. Next slide. Next slide. So next slide, next slide, next slide. So the first picture is say this is the picture where Senai Tottu Vaikal. Then second picture, the baby is feeding using the பாலாடை method. In Tamil we will be saying தங்குல வச்சு கொடுக்கிறது வந்து பாலாடை method அப்படின்னு சொல்லி பாலாடை feeding method அப்படின்னு சொல்லுவாங்க. Okay, next slide. Not only these two medicine, that is urai matri and Seinai, not only plays an important role in the immunity or boosting of health in children. There are some more medicines. Few medicines I have been mentioning is, that is Veelinai, Nellikai Legium, Nellikai Karpam, Amukara Legium, Amukara Chunam, Trachai Manapagu, Valiluvaini, Vallaraini, and Karvepli Chunam. These are the very short listed of medicines, which will also boost up immunity among the infant and childhood age group. So coming to the conclusion, this presentation is mainly concentrated on clinical experience of Siddha medicine among infant and childhood age group, which play a vital role in the area of immunity, that is staying from the first day of the life of infant. Next. Some of medicine that I mentioned, that is Urai Matre, have many research papers in advance, but some of them have not yet. Will be in earlier stages. It will be in earlier days. Then next, does Siddha medicine have a important role in the field of immunity? And these are the reference papers I have referred. And next one, next slide. I would like to thank Mr. Mohan, Dr. V. Rajalakshmi, and my professors, Dr. Mohan Raj sir, Dr. Michael Jairaj sir, Dr. Sriram sir, and my classmate, Mr. M. Mulaga Madhavan. And thank you, Open Attempt team. Thank you.
Great. Thank you. That was
Thank,
beautiful, really.
thank,
Um,
thank you.
because you really gave us a full-on description of how to go about preparing this. I hope nobody, no one of our viewers at home is going to do some experimental drugs for the babies. So please go to your because you know we have the experts, but we are approaching everyday people, and it was beautiful. It was great because
Thank you.
we can see how it works. Um, and one thing is, this was only for because the photos you showed and the ages you mentioned were just about the breast milk and baby kind of childhood, or maybe 2 to 5 years. Is it for older children too, or is it just?
From the infantile stage to childhood stage, we can give urai matire and seine.
Yeah.
So from the first day of life is to boost up immunity of the children. So I've been only saying that 3 to 5 children. So first day of life.
Yeah, but you could still boost the immune system of a 8-year-old too with the
Yeah, yeah,
or
yeah, yeah.
so fine. No, that's beautiful. We had a lot of your time, and I think we'll have uh, a little bit of time to talk about this with the experts. I will just take a look into our questions from the social media and from the chat here. So one is um, just is it is this using Urimatra a common practice in Tamil Nadu, or is it something that is not done anymore?
Urai Madre is given in all OPDs in all over Tamil Nadu and PHC to boost up immunity among children. In OPDs of Tamil Nadu, government hospitals of Tamil Nadu, we can buy Urai Matri, and otherwise we have many pharmacies that produce Urai Matri, and we can buy from that retail shops or from prescribed doctors or something else. This is in practice.
Is it that's just there are so many things already done and in practice, and so normal for certain people, and just a few kilometers or 1 or 2 countries further on, nobody knows about it. And I mean, one final thing I would like to know is, you might have mentioned it, maybe I didn't hear it. Are there is there clinical research and studies on this, or is it just experiential kind of knowledge?
We have a clinical research over Urai Matre, not for pain. Urai Matre, they have done subacute, acute toxicity studies, and more of research papers have been done on the topics of Urai Matre, but not for Saine. You can go with PubMed or something else, and you can take a paper and make a review over that.
Yeah, maybe that should be done. I mean, so half of the thing is not on research. Maybe we should push for that, because at each of these steps we want to find something that is practical and we can do really to go on. So maybe just pushing for clinical studies for certain drugs would be a very practical way to go about it. Anyway, we will move on to our next star here. So thank you for your presentation. It was really great.
Thank you.
I learned a lot, and please stay with us and throw in some questions if you have. For now, we say goodbye to you, and we go to the next one. Thank you.
Thank you. Thanks.
So now let me see. Our next doctor is already in the house. Yes. So I will see if we have to host the presentation. Now we have Dr. Ponnalekshmi, and she will be talking about the development of immunity according to Ayurveda. So obviously she is in the field of Ayurveda, and for all of you who have been with us through the pre-talks and so on, you probably have some knowledge by now about the ways of Ayurveda and how this medicine system works and so on. So just for just
Good
let me,
evening.
yeah, I can hear you. That's great. Very good. So
Yeah.
just,
Good evening.
it just seems to be a little with your connection.
Can you hear me?
I can hear you. You just had
The
a hang.
connection is fine. Yeah, okay, fine.
Okay. Can you
Now, okay, fine.
yeah, that's great.
Can you please share me PPT for me?
Yes,
Here it's not possible.
I will do that. Oops. So there you go. So if you happen to have any issues, then I can start the
Here it's not. Here it's unable to. Yeah, okay. Now it's possible.
yeah,
Yeah, I can.
good.
I can do it from here. Okay, whether it's visible?
Yes, we can see.
Okay. Okay, let me introduce me myself. I'm
There you
Dr. Ponnalekshmi D, second year PG scholar from the Department of Shalitantra from Amada School of Ayurveda, Kerala, India. I am going to introduce a new hardware and software kit called as Veda Pulse. We will be curious to know what is Veda Pulse. A Veda Pulse is a hardware and software kit used for objective quantitative assessment of pathological dosha dominance using algorithms of heart rate variability. These algorithms were developed with input from Ayurvedic professionals with expertise in pulse diagnosis. HRV-based algorithm used in the study to access dosha imbalance as its early stage of testing and validation. In the beginning of 2018 was marked with an outstanding event. An article on the use of HRV for determining dosha imbalance has been published by Dr. Ramanohar and Dr. Olay Sorakin. Heart rate variability with clinical evaluation of pathological state of dosha is a big step in the development in our system as it rapidly gets international recognition, proving that HRV method and Ayurvedic pulse analysis are closely interrelated. Ayurveda explains homeodynamics and health in terms of balance of the three doshas, whereas disease is the outcome of the failure to maintain hemodynamics and is understood in the terms of imbalance of doshas. In order to formulate a specific protocol, an Ayurvedic has to determine the exact nature of the imbalance of doshas and the specific substratum in which the imbalance manifests. To a great extent, imbalance of doshas can be understood by careful analysis of clinical symptoms and signs. However, in many instances, it can be a challenge to compute that the imbalance in the terms of dominance and the relative increase of the decrease of doshas. But now it is solved with the help of Veda Pulse. Here, I put forward a case study to support it. Let's come to my presentation. Here I put forward with a case study, an integrative approach on inflammatory arthritis with respect to Veda Pulse as diagnostic tool along with Ayurvedic intervention. Can you please change the slide for me? Next slide.
I'm sorry. It's under your control.
Okay, now come to introduction. The constraint that the natural selection exerts in immunity is unbounded and eternal. Emerging infectious diseases, for example, like COVID, has a much more possible to shape further human history as the epidemics and pandemics of the past. Management of this trait depends on understanding how to intensify the potential of our sophisticated immune system in the service of human health. Autoimmune diseases cope up with the immune system attacks self molecules as an outcome of breakdown of immunological tolerance to autoreactive immune cells. Many autoimmune disorders have been strongly analogous with genetic, infectious, or environmental predisposing factors. Ayurveda has a great role in treating such diseases. This is a clinical experience of inflammatory arthritis caused by altered immune response. Thus, by considering the diverse presentation, treatment must be adapted to each patient. These are my materials and methods. Here, age of a patient, 33, with female old girl, lady, presenting complaints pain in the hand and shoulder for past 2 weeks. Associated complaints nil. Past complaints nil. Investigation. Blood test shows raised ESR of 35. Symptoms. A 35-year-old female doctor professional presented to the OPD of Amrita School of Ayurveda on 15/3, 2021 with complaints of pain in shoulder and hands for the past 2 weeks. There was no other remarkable medical history. Then the patient was undergo diagnosis under Veda Pulse. These are the meridians which has been got from Veda Pulse. The first picture in which we can see many colors. In the yellow zone, it shows the depletion of energy, which means emptiness of the symptoms. Then we can see the green zone, which shows slight depletion of energy in urinary bladder meridian and kidney meridian. Then we can see dark green zones, which shows normal. That is heart meridian, small intestine meridian, gallbladder meridian, and liver meridian appears to be normal in this patient. Then the orange zone, which is slight tension energy zone. Here, the lung meridian, large intestine, small intestine, spleen, and pancreas show slight tension. Then the red zone, which is the area of major tension, which means symptom of fullness, which is seen in pericardium meridian, which is triple heated meridian as shown in the figure. Then we can see the second picture in which it shows the HRV index. It is slightly showing trachycardia in this current patient. Then it comes to analysis other pictures formatted got it from Veda Pulse. Then the first picture shows the increase and decrease of Dhatu level in the current patient, in which shows that there is an increase in Majja Dhatu and a decrease in Asti Dhatu. Then the second picture shows the increase and decrease of doshas and subdosha levels of current patient, which can be analyzed according to this Veda Pulse. Then these are the Shat chakras, which we are familiar with. This shows there is a decrease in the doshas in Vishuddha chakra and then in Swadhisthana Anna chakra. This is the current Shat chakra of the current patient. Then we are managed the patient according to Ayurveda and given Ayurvedic interventions. Both internal and external treatments were given to the patient. and the form of internal medication, Amrutharam Kashayam 20 ml with 40 ml of boiled water orally for twice daily for 2 weeks. Maharashtra the Kashayam 20 ml with 40 ml of boiled water orally for twice weeks. Mahasudarshanam Guliga orally for 2 weeks. Then fever mix, a combination of Amritarishtram, Pipalyasavam and Sudarshanarishram, 10 ml each was given orally for 2 weeks. Then external treatments were given. There include from 15 to 17 for approximately of 3 days, Dukshapinda Sweda with cotton chukadi churna and Kolakulatadi churna was given, which relieved slight relief of pain and swelling of the patient. From 18th to 23rd, 22nd of March for 5 days, Churnapinda Sweda with cotton chukadi churnam and Kolakulatadi churna with Karpasasiti Taila was given, which also provide mild relief to the patient. Then from 18th to 22nd for 5 days, Agni Leba, a combination of 10 drugs was given to the patient externally. Then it's reduced the swelling of the current area. Then from 23rd to 25th for 5 days, Shastikashali Pinta Sweda with Danundaram Taila was given. Then also the patient much felt normal. Then from 23rd to 27th or for 5 days, Pradimarshan Asya with Karpasasthya Taila for 2 drops each nostril was given to the patient. Thus, by all this complete treatment protocol, the patient feels much relief. Then comes to my outcome. Patient reported a drastic improvement in her presented symptoms with a total treatment period of 12 days. Periodical observations were done once in 5 days. Thus, 28 ESR scale showed a marked reduction in its value from 5.1 points, which is highly severe, to 1.9 points, which means remission of arthritis. This is the DAS scale used for the current patient, in which before treatment, it shows number of tender joint count, which includes 10. Swollen joint count is 10. ESR is 35. So total points show 5.1 points, which is highly severe. When after treatment, the tender joint count reduced to 0, total swollen joint count reduced to 0, ESR rate come down to 16. Thus total of 2.1 points. Thus it shows remission of symptoms. Then these are the personalized diet and yoga advised by Veda Pulse to the current patient on this condition. Then comes to my discussion. Principal aim of Ayurveda is to maintain the environment opponent to the ailment. So drugs that having earmarked action in rectifying the pathogenesis can be sensibly selected. Thus, Veda Pulse is a patent system that allows a naturopath to perform express tests for the functional state of the body, evaluate stress level, and provide individual recommendation for rehabilitation, including diet, food supplements, aromatherapy, herbs, and correction of lifestyle. Then let's come to my conclusion. This Ayurvedic diagnosis with Veda Pulse is definitely a better option to maximize treatment outcome early in the course of the treatment, thus improving the quality of the patient. Thus, let me conclude. Thank you.
Great. So that was a fast-paced one, and that was great.
Thank you. Thank you.
Just unshare the screen, please, so that we can.
Can I stop sharing?
Yes, yes.
Okay.
We can get the normal view. So just one or two things that come to mind. You were talking about one person in this.
Yes, sir. Only one patient, and the Ayurvedic intervention was given. He was diagnosed under Veda Pulse, and thus 28 criteria of ESR. Then, according to Veda Pulse, specialized diet was given, and even yoga therapy was prescribed according to individual.
Okay, so this is not a bigger clinical.
Each patient, it may vary. From diagnostic criteria using Veda Pulse, we can depend upon each patient. We can give personalized diet charts and yoga therapy. Then, according to this, we can analyze the dosha level in patients, and accordingly, Ayurveda treatment can be planned.
Right, right. Yeah, it's just. I mean, we have to also just a note from me, maybe we have to rethink the ways of clinical studies also, because with the modern medicine, we got used to take one drug or even one little part of a drug and make do some tests about it and studies and research. But in a way, the holistic approach of Ayurveda or Siddha or TCM or all these,
Clinical study,
yeah, it takes more
clinical
than
studies from,
yeah.
yeah. Clinical studies on using Veda Pulse has been studied and conducted in Amada School of Ayurveda, and it has been published in Scopus Inter journals. We can view from there.
Right, right. No, I mean, we will have to find ways and protocols to make clinical research that encompasses different things that belong together, that go together to make the environment for health. And not just one drug or maybe just one little particle that will change your life or kill the disease or whatever. That's all I'm thinking about, because in your presentation, you also were talking about different parts of the therapy. It's a part that goes for the diagnosis, and then you have certain food and yoga and the environmental situation that has to be worked with, that helps the health part of the patient. So that's what I'm thinking. Maybe we should find new ways also for clinical studies to implement everything, not just the one drug or something. But I think to me that was a great way to just put a spotlight on one possibility in Ayurveda.